coming out of training, I had a lot of different job opportunities and fellowship opportunities that were more the mainstream model of the shot blocks or pain management or steroid procedures. So being a member of IOF and becoming part of this fellowship program and staying on board, now we're 100% orthobiologics, meaning we only use your own blood platelets or your own bone marrow stem cells. So being part of this has 100% given me the direction to heal patients.
So what got me into it is that I wanted something different. I knew there was a big gap between my surgical patients and my cortisone shots, and I was looking for that gap, and regenerative medicine filled in that gap for me.
I started with an acupuncture course, which just kind of opened my mind to different paradigms of treatment and how to help get patients better who previously failed more conservative, typical medical treatments. Then I moved from prolotherapy, then onto PRP, and then of course onto stem cell, and now I'm really integrating all of those different regenerative therapies into my practice.
It's been a complete game changer for me. Before, where people would come in with various different painful conditions, we were stuck using either cortisone injections or physical therapy, which still can be a useful modality, or narcotics or surgery. And we really can bridge that gap, and the majority of people can get better with these procedures.
I've come to the point where this is how I would want to be treated as a patient, or what I would want for my family members. So I'm very excited to learn more.
Basically all I do as far as practice. The traditional model of practice in pain management was steroids and pain medication, and now I can actually focus on trying to help my patients heal and get better, and so that's 100% of my focus, and it's exciting every day coming to work because every day is new and different, and you're always learning new things, as this is an infant field and we're constantly growing and learning.
Wow, learning regenerative medicine has had a huge impact on my practice. You can come into this field from multiple different specialties. I'm an anesthesiologist, very different from a physical medicine doctor. So what that's allowed me to do is take, the basic understanding of joints and how to treat them to a very complex approach. And not only in the treatment, but just the physical exam and the things that I'm looking for. Patients come to you every day in this field, and they've been through the process already. They've had the medications and the therapies, and they're looking at you saying, okay, you're an expert. What are you going to do to fix my problem? And so really it just adds a whole nother layer of options and things to look at and ways to evaluate the patient. And you're giving patients hope that you may have in the past just said, I'm sorry, there's nothing I can do for you. You've had it all. Whether it works every time is one thing, but at least it gives you a new set of tools to work with.
I think the biggest challenge facing regenerative medicine is differentiating how our treatments fit into the continuum of care. Obviously, we are trying to promote tissue healing and functional restoration. These treatments aren't miracle cures, and in some patients they don't work. But identifying the patients who are going to maximally benefit from these treatments and working in that therapeutic niche, I think is key.
So I actually had a knee problem, and I actually was consulting with a lot of different physicians for myself, and I ended up doing PRP on my knee, and I did get some relief from that, and that kind of got me interested. And then I'm in the field of physical medicine rehab, where this is really a very new field within the specialty.
Today I perform knee arthroscopies and musculoskeletal ultrasound as a guide for infiltration and for diagnosis. And also I specialize in studying and applying biologicals, autologous mini-manipulated therapies such as PRP and BMAC to improve the healing process of damaged tissues, ligaments, tendons, bone and articular cartilage. I have been working very hard for the last years in biological and preservation approaches. My first goal is to preserve and restore the native tissues.